Today's conference is being recorded. At this time, I would like to turn the conference over to Chris Jonas. Please go ahead.
Hello, everyone. This is Chris Jonas. I'm the Director of Communications with the National Association for Business Economics. Pleased to present today's webinar. Before we turn to the topic, I just wanted to quickly draw your attention to a few upcoming NABE events. Of course, we have the Economic Measurement Seminar and the Transfer Pricing Symposium here in DC in July. We also have the 62nd NABE Annual Meeting, October 3rd through 6th in Chicago. And we also have the 4th Annual Tech Economics Conference taking place again in Seattle this year. This is the 4th Annual Tech Economics Conference, where world-class business economists will elaborate on the emerging and future data science needs in economic research and practice. We also have a number of upcoming continuing education programs through our Certified Business Economist program. We'll host a number of continuing education programs in the first half of the year, including courses in Dallas, New York, Toronto, Chicago, and later on in Seattle. So stay tuned for CBE updates, and you can find a link to the full calendar under the Education tab on NABE.com and on your webinar screen. We've also recently relaunched our job board, econjobs.org. We have new privacy controls and usability features. You can head over to econjobs.org to find your next project, or to find your next job, or to post open jobs at your firm. Okay, now on to today's event. Please note that the event will be recorded, and the recording will be available to NABE members later today on the podcast page. We will have a few slide presentations during today's event. You can download the presenter slides in PDF format separately in the Links tab on your webinar screen. The webinar will include a question and answer period after the presentations. However, if you have a question, you can go ahead and submit that at any time during today's event. Simply type your question into the box on the left side of the window and then click on Send. Okay, now it's my pleasure to introduce our moderator for today's event, NABE President Constance Hunter, who is Chief Economist with KPMG. Constance, I will turn it over to you.
Chris, thank you so much, and thank you so much to everyone for joining and for our fabulous speakers. I'm going to make very quick introductions because I think we all want to get to the heart of the matter, which is what are the medical issues at hand and how will this impact the economy. So first we will hear from Dr. Catherine Troisi, who is an Associate Professor, Divisions of Management Policy and Community Health and Epidemiology Center for Infectious Diseases at the University of Texas Health and Science Center at Houston. Then we will hear from Joe Brusuelas, who is the Chief Economist at RSM. And then finally we will hear from David Wilcox, who is a non-resident senior fellow at the Peterson Institute for International Economics. So Dr. Troisi, turning it over to you.
All right, thank you. And as I start, I want to remind people who may be watching this later on, we're recording this Monday morning, that things are changing very rapidly. And what I plan to talk about this today are a little bit about the virus and that affects what's happening, the world and U.S. situation, what might happen, comparing flu to SARS-CoV-19, and how to protect yourself. On Saturday, Dr. Tedros, who is the WHO, World Health Organization director, said, this is not a drill, this is not the time for giving up, this is not a time for excuses, this is a time for pulling out all the stops. Of course, the big question is what those stops should be. So I'm going to tell you a little bit about what we know, what we think we know, and what's going to change. And then the bigger list is what we don't know. We know this is a virus we haven't seen before. We're pretty sure it came from bats. We know that it can be transmitted from person to person through droplets, which when you sneeze, talk, sing, the good thing about droplets are they only go 3 to 6 feet. They're pretty heavy, so gravity pulls them down. And so if you're 6 feet or so away from someone who has an infection, you won't get infected yourself. Also spread through fomites, and those are environmental services, door handles, railings, things like that. And that's why we've been talking so much about cleaning those surfaces. We know that the symptoms are similar to flu. Some people might have GI symptoms as well. We know that the elderly, and that's particularly those 80 and above, but 70 to 80 also at higher risk. Those who are morbidly obese, those who have heart disease, lung disease, diabetes, other comorbid conditions are at higher risk of dying from this virus. We know that the mass-scale quarantines put in place by China bought us some time, but as we're finding out, it is very difficult to contain this virus, and that we're going to need a different approach from that we used for SARS. And I think it's important to remember this is not a one-time event. We are being infected from new viruses and other pathogens from animals frequently. And luckily, most of them don't transmit human to human very well. But sometime that mutation is going to take place, as it did with this virus. And that the cutbacks to public health funding have addressed our ability to detect these. So we're pretty sure the incubation period is between 1 to 14 days, mean around 5 to 7 days. It's more infectious than SARS, but lower percentage of deaths. People can shed the virus early in the infection, and there appear to be super spreaders, people who, for whatever reasons, are able to infect a lot of people around them. What we are looking at now, but will likely change, is that about 14 to 20% of infections are severe. That is, requiring hospitalization, or for the very severe, the critical, they need ventilators, that they have difficulty breathing. About 2% of those infected die, but there's a wide range, and we're still trying to figure that out. As I said, if you're elderly or have a comorbid condition, you're at higher risk of dying. So here's that long list of what we don't know. We don't know whether aerosol transmission occurs. This is different from droplet transmission. Droplets, as I said, don't go any farther than about 6 feet. Aerosol are much smaller particles and can linger in the air for a long time, sometimes even for hours, as with measles. So if aerosol transmission is occurring, you can see where that would influence how many people get infected from one infected person. We don't know what genetic factors there are that influences who gets infected and who dies. One really important thing we don't know is if people, before they have symptoms, or if they have an extremely mild case with no symptoms, or after their symptoms go away, are they still infectious? And there is conflicting data on that, but that's going to be really important to know for the epidemiology. We also don't know when a person is most infectious during that course of disease. We don't know how long the virus can remain in the environment. Because of the type of virus, it's probably not going to stick around for days as some other viruses can. This is on door handles and, in fomites. And there is one report of up to 9 days, but one report doesn't mean a lot. And so those studies, as you might imagine, are being done. We don't know the best clinical management of cases. Right now it's just supportive care. That is, keeping them alive until their body can overcome the infection by itself. We don't have any antivirals, although there are trials that are going on. And then the big question is, will the virus disappear when warmer weather happens? We see this with flu. We see it with some other respiratory viruses. But this is a new virus we haven't seen before, so we can't say for sure that this is going to happen. And then even if it does go away in the summer, is it going to return in the fall, as we see with flu? So the worldwide situation, there are over 110,000 confirmed infections, and 27% of these are outside mainland China. I did a webinar for you all, I think it was 3 weeks ago, and that number was 1% outside of China. It's and for the 11th day, it could be 12th day in a row, there are more cases reported outside China than inside China. We've seen almost 4,000 deaths. We've seen 108 out of about 190 total countries in the world that have reported cases, and we're seeing community transmission. The WHO, for whatever reason, has not called it a pandemic. It is a pandemic. But what we're seeing as well as an infodemic, that is a lot of misleading information out there on social media and indeed by some of our officials. And as you may know, there has been a rapid increase in cases in Italy, Iran, and South Korea, and that is concerning. A quarter of Italy's population is under quarantine as of this morning. This is just to show you where cases are occurring, and although it started in China, look how red Europe is, and all those pockets in the United States. So in the United States, we've seen 537 cases as of last night. The problem is we're not testing, and you can't find what you don't test for. We're seeing community transmission, and we've had 21 deaths. We've seen cases in 34 states. Health departments are doing contact tracing, that is following up if someone is diagnosed with COVID-19, then the health department will trace who they may have come in contact with and then put those people under quarantine or self-quarantine. As I said, you can't find what you don't test for. There has been a problem with the kits, and the number of kits that are being rolled out to state and other big city labs is increasing. Quest and LabCorp have announced that they will be testing for the virus as well. What's going to happen is once we start testing, we will see more cases. It doesn't mean there's a big increase in the number of cases, it's just that we're detecting them. And to put this in context with flu, we estimate that there have been almost 30 million infections with flu since October 1st of last year, 280,000 hospitalizations, and 20,000 deaths. We've seen 130 pediatric deaths, the second most since we started recording that. So it's been a bad year for children. So what you all want to know, what's going to happen? Well, I don't have my crystal ball, but I think epidemiologists would all agree that it's going to be very hard to contain the virus, and that we're going to see a lot more cases. What we don't know is whether it's going to be a mild illness, moderate, or severe. Certainly people in those high-risk groups, as I mentioned, older, comorbid conditions, are going to be at higher risk. It spreads easier than SARS, and if we find that there are a lot of mild infections, and we are in the middle of flu season, so you might have the virus and confuse it with the cold or flu. Indeed, this seems to be what was happening before we were testing, it's been circulating for at least a couple of weeks in Washington. That means people are getting infected. And we may see, it may just become seasonal like flu, that we see it every year. We need to move from containment, that is these massive quarantines, to control, but this is going to require international cooperation. Social distancing is something we've already seen started, that is closing down schools, public gatherings, etc. And let me get my next slide. This shows that we know social distancing works. This just shows you what happened during the 1918 pandemic, where one city, Philadelphia, did not ban mass gatherings, and you can see that solid line had a massive increase in cases, whereas St. Louis, which intervened early, did not have as many cases. So are we prepared? Well, probably not. There is not enough, depending on how bad it gets. The hospitals don't have enough personal protective equipment. We don't have enough medical beds. Again, we're in the middle of flu season, and hospitals are full with flu patients and ventilators used by severe flu cases. We just don't have enough of these things. We're also seeing infections in healthcare workers, which means that they aren't there to work. And we may, as we see more infections. You know, see public safety workers, teachers, etc., who also are not able to do their job because of infection. An emergency funding bill was signed on last week, and that will help. You know, we'll see how much money is needed in the end. And health departments are working overtime. They are underfunded, and they have regular things they have to be doing, and they are devoting all their time to, well, a lot of their time. There are things they still need to be doing to working on coronavirus. So the big question, how bad will it get? Well, you need to look at 6 things. How contagious is the virus? It seems to be pretty contagious. How deadly is the virus? How deadly is the virus? It's less than SARS, but we're still, because we're not detecting all the milder infections, in the end, it may not be as deadly as we're fearing. But that's an unknown. Are people infectious before or without symptoms? We don't know. How much have infected persons traveled? Well, a lot. We live in a global economy, and before Hubei province shut down flights, there were 3,500 people a day flying out of Wuhan to other countries. So you can see that the opportunity for spread was very high. How effective is our response? Well, we don't know. They need to switch from trying to contain the disease to focusing on resilience and, again, protecting those vulnerable populations, the same as we do for influenza. And then how long to develop a vaccine? It's going to be at least a year to 18 months. It requires a lot of money. It's both an art and a science. You have to pick the right part of the virus to make the vaccine too. You have to do a lot of safety testing, and you have to do a lot of efficacy testing to make sure that it works. And this takes time. I would be surprised if we have one in 12 years. There's a lot of business reasons, too, why pharmaceutical companies have not been working on, for example, a vaccine for SARS. It takes money, and the return on investment isn't there because, unlike hypertension medicine that you take for the rest of your life, you get a shot once or even yearly, and that's it. Those are the things that will affect how bad it's going to get, what will happen. This is, I thought, an interesting graphic that shows you compared to other diseases. So the x-axis is how infectious it is, and the y-axis is how fatal the disease is. And the box is the new coronavirus. So there's a big, is it going to be as bad as Spanish flu? 50 to 100 million people died across the world in 1918, 1919, when the world population was a lot smaller. So is it going to be up in that upper limit, or is it going to be down not so bad? And that's really what we don't know. Scientists are working on new tests to detect the virus. As I mentioned, a vaccine, there are clinical trials going on for antivirals to help people who are already infected. So to compare flu with this new SARS-CoV virus, it looks like the coronavirus is more likely to cause severe infections and have a higher mortality rate. For those who are most at risk for flu are children, particularly under 5, pregnant women, elderly, comorbid conditions, and immunosuppressed. For COVID-19, and again, we're still learning more, but it looks like children are not at high risk, which is good. It's older age comorbid conditions are the people who are at risk of severe disease or dying. We don't have a treatment yet for COVID-19. We have vaccine for prevention and antivirals for treatment for flu. They are transmitted in the same ways. Flu has a shorter incubation period, and you can transmit the infection before you yourself have symptoms, so it can spread faster. Estimates are that 3 to 11% of the U.S. population is infected each year by seasonal flu. So the R naught, a measure of how infectious a virus is or pathogen is about, the estimates right now are 2 to 2.5 for SARS-CoV. That means each infected person infects 2 to 2.5 other people. For flu, it's 1.4. And we know with flu epidemics, it's children that drive the epidemic. You know, their hygiene is not that great sometimes. So you get them together in school, they pass it around between themselves, and then they bring it home to their parents. We don't know whether that's the case with SARS-CoV-2, and that's important information to know about whether closing schools would be effective in stopping the epidemic. So I'm going to, you can look at these slides later. These are all the things you've been hearing about how to reduce your risk and other risk. There is new guidance about travel. CDC is recommending you not travel if you're in one of those high-risk categories. You can go to ready.gov/kit to find out what you should have to be prepared in case we do see social distancing, widespread social distancing occur. And then, again, public health funding is important. It's been going down. It's just really important to support public health when there is not an epidemic so that we're prepared for when one is. And that is it. Thank you.
Thank you so much. That was fabulous. Now, Joe, we're going to turn it over to you to talk about some of the economic impacts.
Joe, are you with us?
Joe, are you there?
Please check your mute button. We're unable to hear you.
Constance, why don't we move to David?
Yeah, let's go to David first. That sounds great.
All right. Are you able to hear me?
Yes, perfectly.
Yes, we can hear you.
Go ahead.
Okay, I'm going to focus my remarks on designing a meaningful policy response to COVID-19. I think a starting point is to note that especially during the earliest phases of the outbreak, the overwhelming priority, I would say priorities number 1 through 25, consistent with the remarks we just heard from Dr. Troisi, must be on the public health dimension. One useful benchmark is that in 2014, $5.5 billion was provided by the federal government to fight the Ebola outbreak. I think it's apparent that much more will be required here. The recent bill is a good start, but far from the last word. During the initial health emergency, as the most severe social distancing measures are still in force, there's very little that will be feasible to do in order to limit the economic damage. I thought I'd list a few of the exceptions, though. First of all, again, consistent with Dr. Troisi's remarks, it's critically important to provide maximum support for the development of the vaccine, research into whether an antiviral treatment can be developed, and so forth. There's a certain amount of basic blocking and tackling that's not very glamorous, but providing equipment and training for frontline medical workers, EMTs, and so forth. And this is just things like gowns, gloves, masks. It's really beyond conceiving that we would be asking these people to put themselves literally in harm's way without adequate training and equipment. And in addition, there's basic steps that need to be taken in order to expand and maximize the capacity of the health system, providing respirators, making sure that hospitals are building capacity as rapidly as possible to treat patients and so forth. more in the realm of fiscal policy, which if the public health agenda is priorities 1 through 25, then fiscal policy should be probably 26 through 30. My own view is that we ought to contemplate steps that in other circumstances would be really fairly difficult to conceive. For example, I believe we ought to consider free testing and treatment for the disease in order to ensure that individuals don't avoid detection out of fear of the possible financial consequences of being diagnosed as having the disease. We ought to, in this unusual circumstance, be providing temporary paid sick leave for those whose employers don't provide that. And I think, especially if the situation becomes more serious, I think we're going to need to consider providing some form of temporary income insurance for the duration of the public health emergency. Our unemployment insurance systems really are not well suited for this specific set of circumstances. Paid sick leave may not do the job because some people themselves may not be sick but still required to not be at work and earning income. I think it would be possible to design a system here where the government could require an employer to certify that persons receiving support are on reduced income due to the disease. The provision of this kind of income support to be limited to both geographic areas and time duration of a public emergency. This would be obviously a new venture and so difficult to design and implement, but work on something like this, it seems to me, ought to be getting started right away. We ought to be figuring out a separate agenda, some way to replace the nutrition that usually is provided through school cafeterias. Roughly 50% of public school students in the United States are eligible for free and reduced lunch, and we know that their nutritional quality declines when those meals are suddenly not available. My own alma mater, the Federal Reserve, of course, will have to play a role in the background here in monitoring financial markets and institutions to ensure that they continue to function well, but especially in this early initial health emergency phase, the Fed's role is going to be at most secondary. Over the longer term, some more traditional fiscal stimulus will probably be required. We don't know for sure how serious the macro situation is going to become, how much it will deteriorate. Therefore, I think we ought to begin getting started now on an urgent basis, activating some kind of fiscal distribution that could be triggered on if, for example, the unemployment rate increases by, say, 0.5 percentage point or more. That's been a very reliable indicator, as Claudia Somm has pointed out, for a recession being in process. So to give a concrete example, the Congress could now pre-position a 2 percentage point cut in payroll taxes to be triggered on if the unemployment rate rises sufficiently, and then triggered off when the unemployment rate comes back down to some pre-specified threshold. Others have advocated sending out rebate checks, a flat amount to everybody who paid payroll taxes, say, last year. I'm perfectly fine with that. The point is to get something pre-positioned now. I think even that would be modestly helpful, at least in shoring up some confidence that the fiscal machinery is there to put a floor under the situation. And a positive legacy of this terrible situation could be a system like this is left in place long after, hopefully, coronavirus is nothing worse than a bad memory for most of us. Namely, we really need to strengthen the automatic stabilizers We know that monetary policy space is extremely limited at the moment, and so if we come out of this situation with a strengthened set of automatic stabilizers, that will be a positive step. As I said before, monetary policy is at best a secondary player here. I put it at about priority number 31. It operates with a long lag, and there's no difference, no reason to think that it will be different in this situation. I think last week's step by the Fed to cut the funds rate by 50 basis points was useful in showing that it's alert, it's on the job, and it stands ready to do what it can. But there's not much room for the Fed to ease. There's only a percentage point more on the funds rate, and any palliative effect that that's going to have will manifest over the next probably 4 to 6 quarters. That's traditionally how long it takes for monetary policy easing to have some positive effect. One last critically important thought that I'll close with is that as the policy responses are designed, it is absolutely essential not to require that everything be designed and implemented before anything can be done. We have to be able to move forward on multiple channels, and that as specific sensible policy responses are ready for implementation, ready for enactment and authorization by the Congress, those should be allowed to move forward. The more traditional elements here, for example, a payroll tax cut, a cut in the payroll tax rate, those can be designed and implemented relatively quickly. Those are known elements of the fiscal playbook. They should move forward as rapidly as possible. Some of the other ideas that I've suggested are going to take more architectural work by the bureaucracy to design. The other elements of progress shouldn't be held up until those more customized approaches are designed. I'll leave it at that.
Thank you so much, David. Joe, I think you are back with us. So if you are, I'm going to hand it over to you now.
Thank you very much. I apologize for the call dropping earlier. So we're in a very interesting situation where the economy is going to experience a number of shocks, both a supply and a demand shock, in addition to what's clearly a financial shock that will likely put the economy at significant risk of a recession, with the possible trough being somewhere in the April to June period. You know, over the last 6 weeks, I've traveled around the economy talking to both clients and C-suite individuals. You know, often the first question that comes up is, what is a supply shock and why should I care? Now, I know when I'm speaking to a group of economists, they would look at each other and say, I don't get that. How can our commercial leaders not understand this? Well, unfortunately, it's a situation where that's the case. So it does seem like there is some uncertainty around what this means. So what we did was we put together just a very simple flow chart here for everybody to take a look at, to think about how this anatomy of a crisis will lead the policy prescriptions on the backside of the very different shocks that the economy is going to absorb here over the next couple months. I think the first one is in the supply shock. We can already see it in port shipping and container datas. While we track the data, this is something that's not very sexy and doesn't get a lot of play, but we are beginning to see a lot more news flow around this so that you one can understand and then begin to explain what happens once supplies of, or rather, what happens when imports of goods used at earlier stages of production or intermediate goods, or final goods for that matter, begin to dry up because of the closing of some Asian supply chains. We clearly, as you can see from the news flow overnight, have demand destruction going on in the oil markets. The significant decline in oil prices will likely unleash some disinflationary dynamics. going forward here this year that makes the policy response that much more difficult. And of course, we are seeing a significant decline in asset prices. The stock market, the equity markets are all down over 20% from their most recent highs. And you will see a negative wealth effect on the back of this. I want to take time to remind everybody that the U.S. economy is unusually exposed to the two upper quintile of income earners. That's the 40% of households who are responsible for 61.4% of all spending. And we've seen over the last few years, especially since the financial crisis, anytime we get excessive volatility, you do see the upper end pull back in ways they didn't during previous business cycles. For example, in the final quarter of 2018, we saw roughly a 20% decline in asset values across equity markets. We went from a 3.5% rate of household consumption to an average of 1.2% over the next 6 months. So this just makes the policy response that much more important. And I would concur with everybody here on the call that time is of the essence, that the federal government should move to begin pre-positioning policy to address what's likely to be a very sharp and sudden shock across the economy during the months of March, April, May, and June. And we'll talk a little bit more, as David did, about the proper place of the fiscal authority versus the monetary authority. Now, here is the best and most up-to-date data that we had on West Coast port activity, and we compare it to GDP growth. And what you're looking at on the left-hand side is yearly growth of loaded export and import containers at the Pacific seaports. And we can see it was down almost 10% through the end of February. And since then, we've gotten more anecdotal evidence of further declines in port activity and indeed an increase in layoffs, which I would expect to be reflected in the weekly initial jobless claims data that we'll begin seeing this week, likely Thursday morning at 8:30 a.m. Eastern. The sort of financial shock that we're seeing has resulted in an unusual decline across the yield curve. Overnight, the combination of the breakout of the Saudi-Russian price war in oil markets unleashed a quotient of fear across global markets, causing individual investors to seek a safe haven move that drove down short-term money market rates and indeed U.S. government yields all the way out the curve. As I talk to you, as I'm looking at my Bloomberg screen, I can see that everything under 10 years is under 0.5%. So we have moved into a very different situation where, because we're going to have lower interest rates for a long time, and the outbreak of the price war in the oil markets would tend to imply that there's a lot more fiscal space here than what conventional wisdom often identifies. And my sense is that if we do face a much greater public health emergency, that the fiscal authority can move in a much more robust way to begin targeting households, injecting cash into their pocketbooks, engaging in regulatory forbearance, essentially leaning on the banks to work with households, small and medium-sized enterprises that are under financial distress due to a temporary disruption in wages and revenue. And this just gives you a sense here, I think, of the dramatic turn in the fortune of the economy and just what sort of fiscal response will likely be needed to provide bridge financing, especially for those small and medium-sized enterprises that comprise Main Street that are likely to face significant declines in revenues through no fault of their own. We're beginning to see some stress, dollar funding stress, stress in high yield, and stress in investment grade markets. It was extremely sharp when we opened up this morning, and this does tell me that there's likely going to be a further decline in the federal funds policy rate and the construction of a standing repo facility to take care of the problems at the front end of the market overall. I'm in Los Angeles today, so I got up quite early to prepare and to really make sure that I was on top of the data. And I have to tell you, when you look at the front end of the market and it was in the negative, it does give one a sense of the clear and present danger to the risks around the economy linked to the COVID virus, and now you've got a layer of uncertainty caused by the interesting interaction between Russia and OPEC. Here, this is real, what I would call inside baseball, but it's the FRO-OIS spread. It's a measure of risk to the banks. And you can see just over the past few days how that spread has widened significantly. This does denote perhaps a pivot towards more robust action out of the monetary authority, and one would hope a signaling of intent by the fiscal authority to actually get in the game in a much more interesting way than just providing $8.3 billion. And I want to go on record here and say that the scientific community said that they need $15 billion to address the medical side of this. The Congress should move swiftly to fully fulfill that request, because that's clearly more important than any of the things that I'm particularly addressing here. One of the big lessons from the financial crisis was that we economists often didn't communicate in ways that we were capable. And when I talk to an economist and we talk about recession probabilities, I've got my core 4 models, she's got her core 4 models, but it's important that we speak clearly in an accessible way so the public understands what's happening. I think one of the things that we can do is to look at easy to understand economic metrics, such as the initial jobless claims that comes out each week at 8:30 a.m. Eastern. If the level of claims moves above 242,000, we're either in or soon will be in a recession, which would require much quicker action out of the fiscal authority and, of course, the Federal Reserve to engage in very creative policies to ensure financial stability and economic stability till those policies put forward by the fiscal authority can flow through. All right, my sense here is we know what to do to address the series of supply, demand, and financial shocks that are currently cascading through the economy. We know what to do, and we know how to do it. It's just a matter of, can we move the discussion along to the point where the administration recognizes the Fed can only do so much? That what's really called for here is a set of policies that will inject cash into household balance sheets, whether that's through direct payments or a temporary payroll tax holiday. It would be a smart move to begin thinking about the tariff holiday or just a permanent reduction in tariffs to zero once we begin to emerge from this to jumpstart trade in the global economy. Should, in the unusual and exigent circumstance of a far worse breakout of the virus that requires much more stringent conditions put forward by the federal government, in my estimation, it will be required that a temporary lending facility be set up to target those small and medium-sized enterprises who will face bankruptcies and whose workers will find themselves unemployed on the other side of this. What cannot happen is that fiscal policy be put forward that's just another form of crony capitalism, or that simply targets the large firms who can already tap the broad and deep liquidity markets of the United States. That there should be a focus on those SMEs. And I think that that's probably one of the discussions we economists really can help inform. If there's a real exigent circumstance in the transportation industry, that's fine. After 9/11, we provided $15 billion to prop up the airlines. These are things that we're going to have to begin talking about should the status quo not hold. Okay, it's 12:15, and I want to stop there so we can keep ourselves on time. Constance, back to you.
Constance, are you
So
with us?
sorry about that. I went to my face recognition did not work, and my phone had gone silent. But we have a number of questions coming in. I just want to ask first question to Dr. Troisi, which is that when we compare this to the Spanish flu and we think about the medical care that was available then, certainly we would, even if we had a repeat of the Spanish flu, would expect the mortality rate to be lower, would we not? We have ventilators, we have IV drips, we have all sorts of other medications and care that we can provide to people to help them survive this. So I guess my first question is, what are your thoughts? If that were to occur today, wouldn't you expect the mortality rate to be lower?
Yes, in high-income countries, but this is a pandemic around the world, and not everybody has access to that advanced medical care. Also, as I mentioned, we do have a shortage of that equipment and of hospital beds. The other thing is that with the Spanish flu, people were dying sometimes of a secondary bacterial pneumonia, which we could treat, but sometimes it was primary from the flu, which we don't usually see, and that is much harder to treat without antivirals. And it also it can happen quickly. I read a report today from the nursing home in Seattle, or Washington State, I'm not sure it's in Seattle, where the nurses were saying that patients would be fine 1 hour and a couple hours later dead. And this is very disconcerting because it may be imitating what we saw in this flu. So, you know, the short answer is yes with some caveats.
Got it. Well, we have another question for you coming in from the audience, which is a typical economist question, which is, can we consider the death rate from the Diamond Princess outbreak a solid data point or a natural experiment? In other words, that it was isolated, but from what I understand, that they didn't let doctors on board right away, so I'll let you go into the details about that.
Yeah, I mean, it's certainly one data point, but if you look at your typical cruise patron, they tend to be older, so it's not representative of the population as a whole. And then, you know, there were mistakes made in handling that, as you mentioned, and so, again, it's one data point, but it's not going to give you, it's not going to be the definitive answer.
Great. And then we have another question, which is that Korea has been testing 10,000 people a day for over a week. When do you expect the U.S. will get to even 1,000 tested?
Well, I think we are about 1,500. But in the spirit of the question, you know, hopefully within the next couple of weeks, we will have more testing capability. I personally think CDC made a poor decision by not using the WHO kits and using their own, which had a problem. They were giving indeterminate results, so you couldn't tell whether it was positive or negative. It took 3 weeks to fix that problem, and we didn't have any testing kits. Korea and all those other countries that are testing lots and lots of people are using the WHO kits. And you'd have to ask you'd have to ask CDC why they made that decision.
Of course. So we have a question, Joe, for you. What was the number that you said jobless claims need to reach? Was it somebody thought it was 240,000? What is the increase per week that would correspond to a recession?
It's the 5-year moving average of the business cycle, and in this case, it would be 242,300. So a sustained move above that would be sort of to consider the doppelganger of Claudia's rule, right? And it's just a little bit easier to explain for some people who aren't economists.
Right. And, of course, if people are getting furloughed, they probably won't go and file for unemployment insurance claims. And, unfortunately, the BLS counts furloughs as unemployed. So there's not really a mechanism right now in the data to see what we expect if the social distancing continues, how firms are going to treat this. So it'll be a data challenge for sure. And
I think that's right, and it informs the policy response. No, I think, Constance, you're spot on. Not only is that correct, it really points to the policy response that's going to have to be put in place. because of the unusual difficulties around this once business revenues dry up and people are temporarily furloughed because their wages are going to get hit too.
So, Dr. Troisi, I have a question for you. If we were to social distance as a policy and more aggressively for, say, a month, would we expect the virus to then die down? Like if you were to make a policy prescription, regardless of the economic consequences, just to say, you know, we want to kill this thing, what would your policy prescription be?
You know, it's hard to make that recommendation without the economic considerations. A quarter of the U.S. doesn't have paid sick leave. We need, you know, as we saw in Japan where they closed the schools, there was a shortage of nurses because the women were home with their children. And the other issue is that okay, I'm in Houston. My husband teaches at Rice. They closed this week and next week is spring break. Now those kids are not going to classes, but really you think they're not congregating? You know, it may be too late for that. And again, considering the economic consequences, and because we don't have a good idea of who's spreading it, is it children? Is it school-age children? If they are the ones that are the main drivers of spread, then yes, closing the schools for 2-3 weeks might stop, at least slow down the spread. But we don't know that that's true, and the indications are that it's not true. It's not children that are spreading it, that it's actually children are getting infected from adults rather than the other way around. So, you know, the problem is social distancing comes with a cost. Think about closing churches. If there is widespread infection with deaths, people are going to want that comfort of going to religious services, synagogues or mosques or churches. So, you know, it's hard to say it, to make a recommendation outside of the economic and social consequences. What we found during H1N1 was that when schools closed, that the teenagers were going to the malls. So, again, you know, It didn't have the desired effect.
No, I can see that. Well, so this brings me to another question for David. How do you think the current political calendar affects the timing of the stimulus? And also, could you enunciate some more direct ways for the Fed to provide liquidity to affected businesses?
So the political calendar, are you referring to the fact that we're in an election cycle?
Well, it's a written-in question, but let's go with that assumption. That's how it was written. So we have questions coming in from the audience. That's how it was written. I think that is a person who is well aware of how to use nuanced wording to make a point. Well,
the executive and the legislative branch are not famous at the moment for working like a well-oiled machine, but I think over the history of the United States, those two branches of government have demonstrated a capacity when circumstances called for it to take concerted and effective action, and one can only hope that they will rise to the occasion in this instance. So I guess my hope is that leadership will understand that the public health imperative requires that political considerations be submerged here and that effective action is taken. As far as the Fed providing liquidity, I'm not sure that the Fed has the statutory authority at the moment to take what most people have in mind in that regard. The Fed did implement a variety of liquidity providing steps during the financial crisis, but those were situations where the Fed already had the statutory authority, and some of those authorities have been tightened up so that it would be difficult to implement the same kind of program in today's circumstances. They're also, by their nature, some of what people have in mind. For example, financial support for small and medium-sized enterprises are beginning to tread awfully close to fiscal policy. And so, again, I think the legislative machinery is going to have to kick into gear here, and the Congress is going to have to express what it wants fiscal policy to do.
Thank you, David. So, Dr. Troisi, a question coming in: have the CDC kits been fixed? And there has been some conflicting information regarding whether or not widespread testing is available. So if one thinks they have coronavirus, can they go to the doctor and get tested?
So the kits have been, I guess you would say, fixed. It was one component out of 3 that was the problem. So what CDC is saying is just use 2, just test for 2 parts of the virus, not 3. Whether that affects the accuracy of the tests, you know, I have not seen any information about that. And that's, you know, we tend to assume test results are always correct, and that's, every test has, no test is 100% sensitive. That is, it detects every case, and 100% specific. It only detects, for example, in this case, SARS-CoV-2, and not other coronaviruses or other viruses. So that's one issue. And there have been some disturbing reports about accuracy of testing of some other kits, not the CDC ones. I just haven't seen anything about that. So right now, there is not a widespread testing. I can tell you the situation in Houston. Houston, Harris County is about 8 million people. We have the capacity to test. We got a kit with 700. That's 700 out of 8 million in the greater area. But you can't actually test 700 people because you have to do controls. So no, right now there's not a ability to get tested if you want to be tested. When that'll happen, we're hoping. We thought maybe it would happen at the end of last week. It hasn't happened yet. So, next couple of weeks. But you do have to go through your doctor. You can't just go get tested. Your doctor has to order it, which is true with any lab test.
Of course. But I think the question is, if one goes to the doctor and says, I've been around people who appear to be sick, or that they haven't been, I've been widely circulating. I was at the APEC conference, name something, can I get tested? Is that a thing that if people go to their doctor proactively to get tested, are they able to get tested, or is there a protocol where they have to show a certain number of symptoms before they're tested?
That, as you know, that was an issue early on. That has been relaxed, but the availability of test kits is going to depend on where you are in the country right now. So maybe.
Okay.
That's my answer.
So we are running up against time, but we do have one more question that I think we can give some very brief answers will be really important, which was regarding the impact to the overall economy and in trying to overcome expected weakness in Q2 and Q3. And I would just editorialize, I think we're going to also see weakness in Q1. Would fiscal stimulus in the form of infrastructure spending be a strong consideration given the time it takes to spend money as well as the limitations in the current construction workforce? That seems like a typical economist answering the question and stating a view, but I would love our 2 economic respondents to answer that.
Sure, Constance. This is Joe. I'll have the first answer.
Joe, you go first, and then David.
Okay. The country needs a broad and sustained multi-decade improvement in its infrastructure. The idea that we could turn to infrastructure spending to rapidly increase jobs seems to me to be inconsistent with the experiences of a decade ago, or the institutional memory we have about when we built out the highways and the freeways. from the 1950s to the mid-1970s. So sounds like a good talking point. Somebody out there is very politically astute, but the economics of it are somewhat different.
I think Jill puts it very well. I don't have anything to add.
Okay.
There are other channels of policy influence that we need to pursue much more urgently, but infrastructure isn't the right tool for this situation.
Got it. So someone's asking, we'll just do one more question, does an aggressive fiscal policy response make sense if the coronavirus ultimately doesn't have a large impact on public health? Or do we need to be aggressive anyway because of the way the markets are reacting? David, I'll let you go first and then Joe.
Yeah, I think it's a fair question. That's why I've grouped the policy responses that I think should be lined up in two buckets. One is the sort of customized kind of boutique responses to this particular situation. Those, by the standards of the federal government in the United States, will not be all that expensive, and I think we're very likely to see the need for those. The other bucket is a broad-based program of aggregate demand stimulus, and there it's true, our outlook is clouded by tremendous uncertainty about how extensive the economic damage is going to be. That's why I've suggested conditioning a broad-based aggregate demand stimulus on something like an increase in the unemployment rate of more than a de minimis size. That's a way we can know that we're expending large-scale fiscal resources in a responsible manner.
Thank you. Well, on that note,
go ahead.
Yeah, sorry.
Yeah.
So Joe, go ahead. Sorry.
No. Okay, real quick. My sense is that the premise of that question is very interesting because we can already see the supply shock moving through the economy, and it's hard to make the case that, say, you're looking at monetary policy, that the real neutral interest rate already hasn't fallen from 0.5% to 0, which would imply that even at current levels, monetary policy is tight and needs to be put in a more accommodative space. So we're going to have to move it at the very least on monetary policy, and I don't see how we don't get around the very fun ideas that were put forward here on fiscal policy.
Thanks, Joe. Well, Chris, I think we probably have to wrap it up. Thank you so much for everyone who participated, and thank you very much for joining. NABE will continue to stay on top of this and have future webinars to inform everyone about what is going on and draw upon our long list of experts who are very thankfully willing to come on and give their time to keep everyone informed. Chris, I'm going to turn it back over to you.
Great, thank you. And I want to thank everyone for participating in today's webinar, which is Copyright 2020 by the National Association for Business Economics, with all rights reserved. This does conclude the event. You may now disconnect.